In fact, it was July last year. Boris Johnson said that we discovered too many care homes didn't really follow the procedures in the way that they could have. Now, as a provider of social care, how did that make you feel?
Incredibly angry. It was unbelievable, really. The fact that we, like many providers, and we work in partnership with other providers as well, were basically doing the best we could do with without adequate PPE, without guidance that made sense, been basically left to get on with it. Um, and to somehow suggest that we were not doing everything that we could around infection control, that's something we do anyway, the same as care homes. We had to train people very quickly to think in more clinical terms in terms of infection control around mask wearing. We actually went over and above the guidance around the PPE that people should be wearing. We learned from the first wave that when we knew the second wave was coming, that we needed to do something more. So we actually provided enhanced PPE with things like FFP3 masks, where somebody either tested positive for COVID or it was suspected they had it. That's not in government guidance. It's very confusing, their guidance. And we've got passionate, committed staff who, some of them were camped out in services at the time to make sure that shifts were covered. We had people furloughed very early on because they themselves were sort of clinically extremely vulnerable. We had people, there wasn't testing early on, so if anyone had any symptoms, a slight cough, they were off sick. One of my services lost over half its staff team overnight for that reason. Everybody pulled their weight. Everyone has done everything they could do, and to make sure we got the training in place about how to don and doff PPE, things that staff within social care, and they're not used to working in hospitals. We had to do the same things. And I think that we know that the virus swept through care homes and thousands of people died. And yet Boris Johnson seeks to blame those individuals. It's distressing. It made us angry. It makes me upset now thinking about it, because we are by no means out of this. So I find it, and the fact anyway that, as I say, he's forgotten the whole group of people in any case. So I felt like saying to him, well, where was the mention of supported living? Where's the mention of people with learning disabilities? Despite the fact that people with learning disabilities are dying 6 times the rate of their peers in the general population. People with Down syndrome, we know, were added to clinically extremely vulnerable list and asked to shield. But that wasn't until August last year. There's too little too late. And we have lost people that had Down syndrome. Somebody died very early on in the pandemic. We haven't had an opportunity to even be able to mourn that person properly.